Hello, and it's great to get the opportunity to come and speak to you a little bit about what Mace are doing on health and wellbeing. A few people leaving. So we have been doing a significant amount to get the board buy-in, essentially, to really understand the value of wellbeing within the organisation. So the case study I'm going to give you isn't necessarily a complete piece of work. I want to talk about kind of how we've got the board engagement and the data collection that we'll be doing moving forwards. So our metrics have been really going back to basics. So we started off looking at doing an organisational wellbeing survey in November last year, and that is now tied to our Business 2022 strategy. So we have a 5-year strategy in place for the wider organisation that has now incorporated wellbeing. So for me as a practitioner, that's a really exciting opportunity to actually be tying our business performance with the wellbeing of our employees. So for those of you that aren't familiar with Mace, we're a construction consultancy and facilities management company. We have about 6,000 employees across 50 countries around the world. Sort of traditionally within the organisation, the focus has been very much on health risks. So, we've had a focus around occupational health. We have great benefits in place for our employees, but what we wanted to do was actually really understand how our employees felt about wellbeing and what drove them. And then we'll be using this data to help better inform our benefit strategy as well. So my role sits within the health, safety and now wellbeing team. But work very, very closely with the HR team who look after our employee benefits, because I think we've, as I know many discussions have gone on today, there is such an overlap between departments, and actually if we can work better and more collectively together, we certainly will get better outcomes. So there are 6 key things we've been doing within the organisation. I'm just going to sort of summarise them, but talk more in detail about the actual data itself. So the first thing was around engagement with the Mace Board. So when I joined the organisation, I spent some time with each of the board members to really understand what wellbeing meant to them, because I think what it meant to a lot of them was gyms and apples, and they didn't necessarily see the full business benefits of it. So we, rather than me coming in and telling them this is our definition of well-being, we work with the board to come up with a sort of collective definition of well-being. And then we also asked the organisation. So in our survey in November, we asked people what helps them to have good days at work. And with all of that data, that's helping to inform the sort of the wider well-being strategy. We also wanted to understand our risks. So our wellbeing survey was part health risk assessment, part stress risk assessment, and kind of part sort of psychological wellbeing assessment of the organisation. And that data has been really valuable in building up a wellbeing framework within the organisation that we're rolling out. We've obviously done lots of awareness and communications. So to get buy-in. In November last year, we had the organisation's first Wellbeing Week. And while a Wellbeing Week won't necessarily change the world, it was just such a great way of getting our employees all around the globe engaged with wellbeing. So we used the New Economic Foundation's 5 Ways to Wellbeing, which is just such a simple message in terms of connect, be active, give, keep learning, and the other one. This is on the spot. But yeah, the 5 Ways to Wellbeing is just such a simple way of getting people engaged with the messages around wellbeing. We did a lot for World Mental Health Day as well. So we can see through our employee data, so through our PMI and through our absence data, as with most organisations, mental health and musculoskeletal are our 2 top reasons for people being off. So we know that's an area we need to focus on. We now have about 80 mental health first aiders within the organisation, and we're rolling out a wider training programme to cover our managers and sort of awareness for all employees in the organisation. But it's that kind of getting people talking. So the communications we've used and sort of the branding for wellbeing within the organisation has been really helpful at getting that uptake. We've talked a bit about the training. We've also been giving training to the health, safety, wellbeing team And we also have a responsible business team. So being in construction, as you can imagine, we have all sorts of targets around sustainability within the organisation. And that team has a real focus on wellbeing as well. And wellbeing actually sits within their strategy. So for us, it's about our sustainability colleagues, our HR colleagues, and our health, safety and wellbeing colleagues working collaboratively together, because wellbeing sits across our 3 disciplines. In terms of the interventions, as I said, we have private medical insurance for all employees. We all have annual health checks. We have a significant amount of other support in place for people, obviously the employee assistance program, and kind of health apps and things that people can access. But for us, it's trying to make sure that that's linked to the data and that those providers actually work quite closely together. And then the process has been our other key area. As I say, from the survey, we've been creating a big wellbeing framework within the organisation based on our risks, so that, for example, a construction site might decide, okay, we can see we have this number of people who are smokers. We can see that not many people on this site are eating healthily. We know those are our risk factors, so we'll go on the wellbeing framework and access information related to those risks. So what was the wellbeing survey? So I keep referring to it. We asked over 100 questions, which only took 15 minutes for people to fill in, but those 100 questions were around all of these different measures you can see up on the screen now. So it really was a broad understanding of behaviour. Some of the key questions we asked that are now tied to our business strategy are how many good days at work do you have? So quite a simple question, and our organisation on average has 3.4 good days at work each year. So we've set ourselves a target by 2022 of having 4 good days a week, because I don't think we can necessarily get to 5. Not everyone has 5 good days. Maybe one day that can be maybe that'd be our 2025 goal. But we also asked about conversations around health, because we know, obviously, wellbeing sitting within the health and safety strategy. Often managers would default to conversations around safety, and health is sort of the poor relation. And we could see significantly within the data that line managers were twice as likely to have more conversations around safety than they were about health. And again, so it's 35% of managers or employees felt that their managers talked to them about health. So that's 65% that aren't. And that, again, is tied to our KPIs moving forward, so that we can really focus on that metric, so people are having more conversations about health. Because it's not just about the wellbeing elements, of course, it is also about managing the health risks and that we see not only within construction but within our office environments. We're also, with the data, we had sort of some outcome measures that we were very they were very important for us to be able to demonstrate to the board to get their buy-in. So we looked at self-reported productivity within the organisation. So we asked the question, how productive have you felt within the last 3 months? And that measure strongly correlates within the academic literature with actual productivity. And we found that those construction sites reporting, in fact, I have a graph, here we go. Those construction sites reporting higher levels of well-being also had higher levels of self-reported productivity. We were able to tie that to intention to leave the organisation as well. So we asked people, what are your intentions to leave the organisation within sort of the next 6 months? And again, those sites reporting higher well-being had lower intention to leave. And same with presenteeism as well. So we can see within our organisation, our absence rates are likely quite underreported, and that's because we have what we call Mace days, where people have 2 days a year. They can just take them off for any reason if they need to at kind of short notice. Often conversations with line managers, you might work from home if you're not feeling so good. That data's not necessarily in the system. So we can't truly, I think, measure the success of our wellbeing programme on our absence data, given it's so significantly underreported. But the presenteeism data that we collected showed that people are likely to come into work, obviously, when they're feeling unwell. And again, that had an impact on the reported productivity and also reported wellbeing. Now, all of this is, I guess, very interesting, but it is a one-off snapshot in time. So that's why we have got agreement for the board that we're going to be running this survey annually now. It's also been merged slightly with our engagement survey. So this was very much focused on health risks and wellbeing, but obviously engagement is a part of wellbeing that we need to be looking at within the organisation. So that's been incorporated into our next survey as well. To report this back to the organisation, because obviously it was a significant piece of work. We had 3,900 employees complete the survey. That's just under 70%, which was pretty good in terms of survey response. To cascade out to the organisation, we obviously reported on the sort of the business metrics in terms of the productivity to the board. We tied that to average salary data. So again, that we could put a value if we were to improve wellbeing by a sort of a small percentage increase, this is the value it would add to the bottom line. And that is what has really resulted in such an investment from Mace's Group board in wellbeing. And so we've recruited a wellbeing manager to join the team. We have another member of the team joining us soon. And we've obviously invested this 5 years with Robertson Cooper to do our survey annually and building this wellbeing framework to support. So in terms of the results dissemination, we sent out reports to all the different business areas. So, for example, our team who are working on Tottenham Stadium at the moment, they're kind of got quite a tight deadline to start for the football season. They were able to see the sort of stresses that their team were experiencing and have been able to do. They were all quite simply asked to have a wellbeing conversation. So next year there will be some real focused interventions that come out as a result of the survey. But for the first year, it was about your one action as a bit of the business is to sit down and have a wellbeing conversation with your employees. And I know many of our sites have done that and reported back and have actually set up action plans to address certain issues. So it might be making sure that everyone has their lunch break, such a simple intervention, but we can see that people aren't doing that. People are working quite long hours. They're starting up team wellbeing committees within their teams, which has been helpful. And as I say, we're building on the next survey where we'll be asking exactly what actions they put in place from last year to be able to keep building the central wellbeing programme within the organisation. The data that we've collected, every employee also received a report. So there was kind of everyone received something for taking part. So they each got their own individual report. So they were able to learn a little bit about their own health behaviours and their own levels of resilience within the organisation. So it gave them some personalised advice on things that they could do to improve their wellbeing and to improve their resilience. It gave them ideas and support as to where they could go to get help, as well as informing us of things that as an organisation and as business areas we could do. Because I really do think, obviously, wellbeing is a sort of two-way process. It isn't just about us putting programs in place. People obviously have to access those and be confident in the organisation that we're doing those things for the right reason. The other area we're looking at, because obviously being a construction organisation, it's managing the focus on wellbeing, but also really looking at our health risks as well in the organisation. Because I think it's all very well, us focusing on wellbeing. Here's a survey, here are some wellbeing programs that we're putting in place for you. If we're still not effectively managing the health risks or the byproducts of construction on our sites, it just it doesn't come across as authentic to employees. So for us, it's about really getting that balance right, and by upskilling the health, safety and wellbeing team to have those conversations with directors and managers across the business, I think that is really starting to happen across the organisation. Some other analytics that we've been collecting is hit rate. So again, people say, can you, prove the value of the programs you've put in place? Well, it's quite difficult to truly measure the effectiveness of a Wellbeing Week, for example. But what we can do is we can track the hit rates and the number of activities that are taking place. So our Wellbeing Week last year, we had over 270 activities logged globally across 12 different countries, 40 different sites. And we were able to track people getting involved. We recruited 70 wellbeing ambassadors across the organisation. That number has grown to over 90 now, and we're increasing that as we speak, ready for our next Wellbeing Week in November, which will be bigger and better than last year. But as I say, having the 5 ways to wellbeing was something that really translates across all different parts of the world. So rather than saying you must focus on this for your Wellbeing Week, actually some sites, so we had art classes at Battersea, we had lunchtime walks in our facilities management in Oman, we had HIIT workouts, which are quite painful, under the stars in Dubai. So all sorts of different activities across the sites. And I think they really enjoyed it because they were able to take ownership of those activities rather than us swooping in from head office and saying, this is what wellbeing means to us, you do this. Actually, it was saying these are some parameters that you can use to create a Wellbeing Week. And we gave some training to those wellbeing ambassadors. They were then able to go away and really build that engagement. And already we've got sites around the world saying, what are we doing for Wellbeing Week this year? And people know that the survey will also launch again in that week. So I think that will help us increase our utilisation or uptake of the survey, but also increase, therefore, the quality of the data we're capturing and the engagement with wellbeing across the organisation. I think we have some time for questions. Do we? Yes.
Come up and do them from here. Yeah. Great, thank you. That was brilliant. Let's give her a round of applause and we'll do questions. So we've got a few questions coming up. You can see them over there. How did you measure your presenteeism levels?
So it was based on people were given a question: how often do you come into work when you're feeling unwell? Or sorry, how often have you come into work whilst feeling unwell in the last 3 months? Was the question. Yeah.
So it was So you mentioned self-reported a few times, and do you find that that's robust enough for you?
Yeah, I mean, in the literature on presenteeism, that seems to be the most commonly used measure. I think it's, I don't know how you would measure it without it being self-reported.
Question, what per capita budget, oh, no, that suddenly changed. What per capita budget do you have, including dedicated employee costs? Is that something you can share?
In terms of...
How much do you spend per employee?
On HR benefits, I couldn't actually, I'm not in the benefits team, I'm afraid I can't answer that question. In terms of the wellbeing survey and the investment in wellbeing, it is probably a few thousand per employee based on the costs that we've invested so far, probably more than that.
And then what was the benchmark for the wellbeing survey? How did you survey? What's the samples? All employees?
So all employees were invited to take part. The benchmark was, we worked with Robertson Cooper, who benchmarked our data against their other global clients. So we could see the wellbeing of our organisation was slightly higher than other organisations. We are rolling out potentially to our supply chain this year as well, which may have some interesting impacts on the data, because we think some of our supply chain colleagues on site may experience different stresses perhaps than some of our project managers, which I think will be good for us to benchmark Mace with our supply chain as well.
Mm-hmm. And I'll do one last question. How do you communicate wellbeing all year round?
So it is, we have a wellbeing calendar, and it's about that kind of drumbeat of messages throughout the year. So all sorts of different stories based on health days. We try and follow national or World Health Organization days as far as possible, because it links with all sorts of communications that are going on externally. And we also like to communicate externally. So doing activities like this and they Twitter and LinkedIn, all those kind of things, I think employees will often listen if it's talked about it externally, more necessarily than they will when they talk about it internally.
Fantastic.